Be part of our brand. Leadership for God and country.
Hello there, welcome to another fresh edition of your number one program, Health and Wellness on Leadership Television. My name is Winifred Webo, your host and your only guide on today. As you can see, I'm flanked by eminent personalities and their doctors and consultants in their own field. On my left, you have Dr. Udofia Oscar. He is the family physician, chief consultant, family physician in Asoko District Hospital. Thank you so much for your presence today. And on my right, we have Dr. Olumesi Osezwa. He's the senior registrar of family medicine, Federal Medical Center, Abuja. Thank you so much for being part of the program today.
Thank you for
Yes. The Society of Family Physicians is commemorating World Family Doctors Day, and that's what brought about this gentleman in the studio today to discuss family physician. What does it really entail? We've been learning about family physician, family doctor. Of course, first, physician is doctor. So, what's their role to the society?
Thank you very much, and good afternoon to viewers. The family physician is that physician, that doctor, that specially trained doctor, who apart from his basic medical degree, first degree, or which we call MBBS, has undergone additional training that spans almost another 6 years or even more to acquire what we call fellowship. That is with the West African College of Physicians or with the National Postgraduate Medical College of Nigeria. During his training, he undergoes skill acquisition, competencies in areas that will make him to give comprehensive and continuous medical care to his patients, irrespective of age, sex, and gender or gender. And it does not look at the part of the disease of the body that's affected or the nature of the disease that the patient is suffering. It takes the patient as a whole. So holistically, he looks at his biology, the biological aspect, the psychological aspect, the physical aspect, the social aspect, even the spiritual aspect of the patient to arrive at parameters that will help him diagnose what the person is going through in his illness experience, and then solves the health challenge by rendering the most appropriate treatment.
Okay. Now, Dr. Olumesi, family physician, and the name implies, you said patient. Is it a whole family now that you looks at, or just on individual basis?
Okay, well, the family physician doesn't look at the patient in isolation. It looks at the patient in the context of the family.
you know, he, um, patients are actually individuals from a family. And in one way or the other, what happens in the family impacts on the patient. And also what happens to the patient while going through the illness or the disease experience also impacts on the family. So what family physicians do are to they take a holistic look at the patient. In yes, like you pointed out, look bringing the family into perspective, and in that way, it's easier for them to solve the problem of the patient in such a way that they achieve better outcomes for the patient satisfaction as well as doctor's satisfaction.
Okay, thank you so much. Now I want to ask another question. Talking about a family physician, now the WHO gave a ratio of 100, sorry, one doctor to 400 patients. Now you talk about your relationship with patient or family, whatever. Family physician, what is the ratio do we have in the country? Do we have enough doctor ratio to patients presently? A situation whereby we are having doctors using the word Japa syndrome.
Really, we cannot say we have enough family physicians in the country. No, we do not have. And in recent time, at the National Postgraduate Medical College, in an effort to increase the number of family doctors, introduced a postgraduate diploma in family medicine, in which long-time general practitioners undergo some structured training in family medicine and then acquire a diploma called diploma in family medicine. And this admits them to also be uh, called family doctors or family yes, that gets to be busy. Because that is what actually the WONCA says, the World Organization of Family Doctors, which we are commemorating here today
Yes,
on
you
the
are going to talk
19th
about
of this month.
Yes, you are going to talk
Yes, exactly. That as many doctors as possible should be trained, especially in the field of family medicine. And this was enunciated in 2013 when the then Director General of the World Health Organization, Dr. Margaret Chan, in Prague, really brought it to the fore that family medicine was what the world needed globally so that we'll be able to have universal health coverage and health security in the long run.
okay. So family to be trained, family physician is a field that is a specialist on its own.
Yes.
Yes, just like my chief has said, it is a specialist or a specialization in medicine of its own. And just like he said earlier, you have to go through a period of training, and it's usually rigorous, actually, rigorous training for you to be certified as a fellow in family medicine. And that qualifies you to be a family medicine practitioner or family physician.
Okay. So,
Yes.
but given you talked about the rigors involved like that. So, what are actually the challenges you face especially in Nigeria presently?
Well, the workload is always there because when you get to the hospital, you have the population of Nigeria is growing astronomically, and many doctors are also leaving. But the few that are left are now faced with the challenges of having to see, because the patients will not stop going to the hospital when they have to. So you now left, if you go, for example, to the general hospital, you discover that the large patient turnover is still there, but the number of doctors have drastically reduced. So these are the challenges.
So, what do you think is
Large,
hindering? Okay, okay, talk it. I want you to
large
complete
patient
it.
workload. And there may be other challenges, and of course they are the working conditions, the remunerations, and many other things that will make life comfortable for the doctors generally.
So,
And in all of this, you also still have to study very hard because not just we don't just offer service alone. There is also the academic part of the program. Have to go through presentations, go through updates, and then study very hard for exams. So all of these they are actually tedious for or the resident who is going through the training.
So, will you say that that is why many people are being discouraged from studying family physician, being specializing in the field?
Well, I would say yes.
Like in Nigeria presently, like how many family physicians do we have?
Well, I may not be in a position to give the exact number,
Uh,
but I know that every year we produce additional family physicians, both from the West African College of Physicians and the National Postgraduate Medical College. The only thing is that as we produce, some are also leaving. So that is the challenge. And leaving because the work environment in Nigeria is not as conducive. If what they earn in Nigeria is a pittance compared to what they will earn outside, there's no way they can stop anything. It's difficult. Because most of these people, it's not all of them that are trained by government. Most of these people, they train themselves. So sometimes it's also difficult to even restrict them.
So presently we are having a situation whereby this Japan syndrome is hitting doctors, it's hitting hospitals, as most of our doctors are leaving the country in troops. Is there anything that can be done to curb it?
Well, quite a lot can be done to curb it, but this takes some form of political will from the government. Because actually, some of the discouraging factors have to order on things about remuneration and also the working environment. And it takes government intervention to make these things better. So if actually these things are better, lately I actually heard that the National Association of Resident Doctors
Oh
are
yes,
actually going
I
to
was
strike.
going to come to that tomorrow.
Yeah.
They are threatening strike tomorrow.
Yes. They're actually going to start tomorrow. It's a warning strike anyway, and you come to see while the president was giving a briefing, I think he mentioned that earlier they had given a 2-week notice or warning
Yes.
ahead of
That's
this,
what
but up till now, there was no engagement on part of the government. So these are actually factors that push and pull factors that make people want to jackpot, like you call it.
Now let's go back to your day. World Family Doctors Day is celebrated globally on the 19th of every May annually. Now, what's the day about? Apart from, we all know that the most essential part of being celebrating a day or maybe any health day is to draw awareness. What is the day about? I want to share your thoughts on that.
Yeah. This day is really very important to family physicians and family doctors all over. And not just in Nigeria. We celebrate it with pomp and pageantry. It's a day that we bring to fore what family physicians do at their individual centers and also at subnational or even international levels. So 19th of May is known globally. And for this year, the theme is Family Medicine, the Heart of Healthcare.
Okay.
So which means the family medicine, according to that theme, is actually at the heart of healthcare delivery in every society. The family physician is the first contact doctor that allows patients entry into the healthcare system and follows them through, making them to see the other specialists and subspecialists and even the parameters, including laboratory services and other diagnostic services they have to undergo. And then eventually helps to meander them out to continue their care at the outpatient level.
Because you were just waiting, I was trying to take myself on the main when I go to the hospital, how I follow the process.
So it's just a practical example. You see that after going through all those things, you come back to see the family physician. And that's why we say the family physician is the coordinator of care.
Okay.
He is involved in the continuity of care. And that's why we say that every family should have a family doctor. Because when you have that,
some
then
families that can afford it. Really
the family doctors are usually not expensive, these are doctors that are involved in cause effective.
No, but that's how will maybe somebody a groundnut seller have a family doctor,
Of
or
course,
even
they can
those that are
afford.
working as
Of course, it is a matter
it's
of
not that many
choice.
people actually resort to self-treatment before they even go to the hospital.
Well, self-treatment, self-medication is known all
Self-medication.
yeah, is known all over the world, and people will do and continue to do, irrespective of the level of whatever we say. Because there are some people that believe, and even in some societies, it's even thought that it's possible if you allow some people to do some level of self-medication. But we do not advise or subscribe to it because we know,
The dangers
yeah, the
involved.
dangers can outweigh
Okay.
the benefits.
Let's just go on the break. When we come back, we are going to be sharing more on your job as a family physician. Don't go away. Stay tuned.
Be part of our brand. Leadership for God and country.
Leadership TV for God and country.
You're welcome back. In case you're just joining us, this is Health and Wellness reaching you on Leadership Television. As you can see, we have guests in the studio. Doctors belong to society, family physician, and on the 19th of this month, May, is World Family Doctors Day. And they are here to tell us how they are going to celebrate the day and their role, their impact in the healthcare system. So, back to you, doctor. You were sharing things on the physician, how is the first person to receive the patient in the hospital, and all this stuff.
Yes, it is like I said that the family physician is the first contact physician. The patient, of course, you know that most patients that go to hospital, they want to see the doctor.
Oh, yes.
So that doctor is going to see face likely going to be a family physician.
But just when you just said that any patient that goes to the hospital always wants to see the doctor, it just brought me to the rivalry between the doctors and the other health workers. There was a time that, as a reporter then, so I covered this extensively. So the doctor would say, when you go to the hospital, who do you look for? Who do you want to see? Is it not doctor? Do you go to the hospital to say you want to see a nurse? It was really funny. And when you just mentioned it, it just, brought to mind the rivalry. So now the day is going to be celebrated on the 19th of May. What plans do you have in place to mark the day?
Actually, today we are not talking about rivalry because generally, as family physicians, we believe the whole sector should be one family. So our name helps us to exist very cordially. So what happens on that day? We're going to have a health walk, and we start at the Nav Arcade along, I think, Nambia's Kiwe Express. Yes. And then that's actually going to be the venue. There's going to be health talks, health checks in the schools. We have symposia for children, and even essay competition among the school children. And we're having TV programs too,
Okay.
and radio programs to capture it. And of course, there will be a press conference by executive led by the support president. And of course, all family physicians will come out in their large number to celebrate.
Thank you so much. Now, my worry is that with this Japan syndrome, I'm back again to the Japan syndrome that is hitting the healthcare sector in the country. What will be the impact at the end of the day on the Nigerian healthcare sector?
Oh, well, it's going to have a lot of impact if it's not stemmed or if the tide is not stemmed. It's actually, in fact, it's already having a lot of impact right now. Just like my chief said, sometimes when you come to the hospital, you meet a lot of patients with few doctors, and therefore the waiting time of patients, have to increase. Sometimes you see patients who tell you, we've been here for 5 hours. No, the reason is that, yes, the reason is that the number of doctors cannot attend, the ratio of doctors to patients is far, far so wide that the doctors cannot attend to the patient's need. And then also in terms of efficiency, of course, when you have lots of patients to attend to, you don't have enough time to handle each patient as you should handle the patient. So, and especially for us in family medicine, where our approach is mainly patient centered, we are actually about the patient. We want to know what's happening in this patient. We don't see patients as cases, we see them as individuals. So, we need to know what's happening. So, we don't have that luxury of time anymore to attend to these salient issues. So, of course, the eventual consequence will be a drop in the services, drop in terms of the efficiency of services that are being rendered to the patients. And I also want to understand here that the Japa syndrome is not only limited to doctors alone.
We are just looking
Nurses
at
are
those
also
that
going,
have
pharmacists and all of them, they are also going. So it's going to be a vicious cycle that will eventually affect, of course, it's going to be the common man. Because
Yes.
of course we understand
That's-
medical tourism and all of
Yes.
that everywhere. Those who have money to fly abroad, they fly abroad. But those who don't have, will have to be at the mercy of what's obtainable after the. So I think it's something that needs to be looked into. Yes.
Now, Doctor, I want to ask you, now, what are you doing as a society now to ensure that to go out and to recruit more doctors into your fold to ensure they specialize? Are you not
Thank you
doing
so very
something along
much.
that line?
Thank you very much. We train family physicians. Even, for example, in the FCT, we have hospitals that are training family physicians.
Abuja State.
Yes, in Abuja, you have Asoko, District Hospital, Maitama District Hospital, Worcester District Hospital, and we also have extensions into Kuje and Kubwa, which are also used to train doctors in family medicine. Apart from family medicine, we also train in other fields,
Okay.
O&G, surgery, radiology, and others. So these are already put in place. And it's not really every Nigerian doctor that is ready to Japa or wants to Japa. Otherwise, all of us should have Japa.
Yes.
There are still some of us who believe that we need to stay and make Nigeria great because this is our country. Outsider is not coming to make Nigeria great and strong, so it's we that have to do it. So the only appeal is that government at all levels should try to make it possible to have infrastructures in hospitals that work, train doctors and make conditions of working for them conducive. Like people speak about retirement age, is done for teachers, for example, up to maybe 70 years.
Yes,
Most doctors at the age of 70 are still strong and active to work. So by the time you are retiring doctors at 60 and they are still strong, of course they will go into private practice anyway, but the government service will be losing. So these are the issues. There are many other things that government needs to do. And then encourage the train, sponsor the young ones to be trained, to specialize. As a society of family physicians, we make representation to the government at all levels on these issues.
And what has been the response?
Well, it's been it's been good.
Thank you so much. Now, one last word before you go. What are your views? What are you going to say? Or what are you telling the government or Nigerians out there?
Well, what we'll say or what I want to say is that I also reiterate the fact that every family needs a family doctor. Yes, every family needs a family doctor. In fact, the moment a couple decide to start a family, that is the time that is right for them to engage a family doctor.
Wow.
Why? Because between the point of marriage and the point of delivery or the point of pregnancy is a preconception period. Family physicians are very well skilled to handle that preconception period, where they offer education to the patient and all healthcare interventions where necessary, and also prepare them for the family ahead. So the moment a couple decide to start a family, it should be one of the things they should engage a family physician to guide them along the way. Then concerning the issue of training, doctors availability, we just asked that the government to put in some more efforts in terms of remuneration and in terms of infrastructure, so that this place will be more appealing for people to stay and to work. The truth is that Nigerians are very sharp. Nigerian doctors are very hardworking people who are willing to deliver or to give their best to the system. So I think the system should work for them so that those who are leaving can come back, or those who are willing to or who are already preparing to leave can stay back to deliver their best to the people. And finally, I'd say, just like my chief said, without the heart, the body is useless, the life is dead. The family physician is the heart of the healthcare. The heart receives the blood and distributes it to appropriate areas or vital areas. So the government should also look into family physician area and see how to encourage them so that we can have more family physicians, and then better healthcare services, better outcome, reduce hospitalizations, and reduce cost. Thank you.
Thank you so much for that. And Dr. Chief Consultant, what do you have to say?
Thank you so very much. Not much to say, but to say, watch out for the World Family Doctors Day, and then participate and plan and have a family doctor in your family if you didn't have one, because the family doctor is the way to go.
Thank you so much, viewers. You heard it from the experts. From my left, Dr. Dofia Oscar is a chief consultant family physician at Asogoro District Hospital. And on my right, we have Dr. Lumesi. Thank you so much once again for coming. He's also the registrar of the senior registrar, Family Medicine Federal Medical Center, Jabi, Abuja. It's been a pleasure having you on the program.
Thank you so
Look forward to
much.
seeing you more on the program. So viewers, this is where we end today's program. Until I come your way same time next week, I am going to see you. Bye.